the tobacco-free campus part, it has not come to fruition yet. It is still under study, but it is something that's on our work plan for later on. The language was changed in the old smoke-free air ordinance successfully. Go ahead. Can you hit next? Yep. Do you want to give me the driver? The mouse? Okay. We did receive support from the board to apply for drug-free communities grant and a child abuse prevention grant. We did not receive either of those grants, but we are in the works, as you'll see later on, to apply again for the drug-free communities grant. Polk County has never been a recipient of that grant. We hope that we're in position to be able to receive that. It is funding for prevention services for up to 10 years for our youth. The child abuse prevention grant was a collaborative with St. Croix and Pierce counties, and if that one opens again, I think we would consider applying again as a region. The board also recommended a resolution 2619 to encourage Wisconsin Counties Association to work with the legislature to provide additional programs and funding for combating treatment of methamphetamine use for county board passage. I believe that passed. I'm not. I'll have to ask you. So again, we began that discussion regarding smoke tobacco-free policies on county-owned ground. That is a big discussion that we'll be having this year. We began to work with Unity School District to present on youth wellness programs to include vaping, sexting, and truancy. That also is on our work plan for this year. And then we had sent two representatives, John Bonaprize and Joe Demeling, to Madison for Human Services Day at the Capitol. We had some really strong advocacy around increasing our mental health crisis beds in our region. It was very well received by our representatives. And then recommending passage of Resolution 5219, and that was bringing back involvement of opioid legislation. So well done, everybody. Look forward to moving some more resolutions through and recommendations to the county board. So if you are okay with it, Chair, I will do the grant contract update number 6 on our agenda.
Yes, go ahead, Lizette.
Okay, so I just wanted to give you guys kind of an update on some more of our significant grants and contracts that we work on that provide a lot of funding for us. We have, I don't know how many total grants and contracts that we receive funding to do our work, but these are just some of the bigger ones that I wanted to highlight. A pretty big deal was our Wisconsin Tobacco Prevention and Control Program. You could probably associate that with Mary Bowe, who is our Western Wisconsin Working for Tobacco-Free Living Coalition Director. Our grant cycle came up at, I believe it was up at the end of April, and we were awarded the funding again for another cycle. So it's a pretty significant chunk of money, $121,000, for us to continue that multi-jurisdictional work on tobacco prevention. Also, the Department of Children and Families was awarded $53,000 to help provide some more intensive services to try to prevent that need for those longer-term court orders. So we've got that grant up and running this year already. We didn't receive the Drug-Free Communities grant, but we will be applying again. Next slide. Another grant that we bring in-house is the Forward Health Outreach Grant. That's a grant that we match 50% with the state of Wisconsin to provide health benefits counseling to the public. The current money is used to contract with ABC for rural health. But as we have looked at what our operations look like as a division, we have found some areas that we can to probably streamline our internal positions, and we will take that grant and extend out our services by bringing a navigator in-house who can triage our customer interactions on the front end of the customer experience, but we'll also continue to have that contract with ABC for that specialty level of service that they provide. So it's really a service enhancer for us to be bringing part of that grant in-house and then holding a contract with ABC for some other services. That's about it for the bigger grants. Are there any questions of those grants?
I'd like to make a comment on our trip to Madison and our testifying I believe that was last April. Yeah. Joe and I, we met in conjunction with the department head from St. Clair County, Fred Johnson, and I believe that we were trying to get about 90,000, and I think pretty much as a result of our testimony, we were granted in the governor's budget at least another 30,000, Tanya, right? Or
there's been some additional enhanced funding that we've been able to apply for and receive based on our past experience. The mental health beds in this area still have not opened up. They still are not allowing funding for those additional beds here.
So that was a very worthwhile testament, and I'm glad that we met with Fred and the representatives, and I think it helped a lot. At least it was successful. Yeah. Thanks, Tanya.
Yep.
Amy?
Tanya, I have a question on the mental health bed piece. Where are we at now, and what are we striving for? What do you think the future looks like for us increasing our capacity?
I don't know. I think it's up to the legislature to bring it up again in the next budget cycle. How many beds do we have now? Lisa, do you know? Well, in the region. Not enough, for sure. We end up sending our people mostly to Winnebago across the state. So we can get that data for you.
I was just curious where we're at, where we can fit. I'm glad.
I guess, can I make a comment?
You sure may, Dr. Rogers. We'd appreciate it.
I think that the mental health issue, there was $15 million passed by the House and the Senate of the legislature. Unfortunately, this mental health beds were to be built in Eau Claire. Unfortunately, the governor sent that $15 million to Winnebago, so that's why those beds were not built there.
And I think the primary reason is because it was a private-public collaborative, and the state didn't know how to handle that. So it was with Sacred Heart Hospital and St. Joseph's and Chippewa Falls where the beds were going to be added.
I guess I did not know that latter part. There was a private-public partnership.
Yep.
Well, that's good. Usually.
That's one of the biggest issues on the table for the last several years is we're trying to find a middle ground place in the state, and the legislature several times would come up with the money to build a facility, but they can't come up with the money to operate it. Every 3 months, Amy, we have a legislative meeting in Richmond, and we have Senator and Representative Senator Schachter is always there, and the representatives from several counties. And we've had some really good testimony from the Sheriff Department. They're involved in the transportation every time they have a transport, it's a huge amount of money. They have to have a deputy, somebody go along, and they're short of staff the way it is. At one time, it come pretty close to the Baldwin Hospital being a site, and there's a continuing study of trying to find a site and an operation. It's really a big burden on counties in transportation and finding a place huge on our budget. Thank you. Are you still in your presentation, Tanya?
Yes, if we're ready to move on.
Okay.
So we wanted to talk about budget priorities and strategic plan review. So this time last year, we had our budget priorities already. With the pandemic, we're a little bit behind on schedule as far as the county board setting those priorities. So they're in the works for maybe the next meeting to do their priorities discussion or visioning.
We're actually developing the process for goal setting and vision setting, and probably won't happen until mid-June.
Okay. So once we have that from the county board, we will bring it back to this committee to discuss how it fits in with our strategic planning. So I'm prepared to give you our 2020-2022 strategic plan review. If you want to go to the next slide. And basically, with our planning last year, we involved all of our staff in the process and worked with UW Extension on the three main areas that you see on the screens. We used a lean model framework for categorizing all of the needs that we have, or the potential needs and areas of improvement. So the first one is people, which in the lean model is really about culture. So the main themes that came out to us were building internal communication and trust. As far as processes and systems, looking at work-life harmony for employees, investing in our professional and workforce development, and improving our systems and technology. And then the last one is for purpose and service, and that's how are we using our allocated dollars to be able to enhance our services to our customers and clients. So over the next 3 years, that's what we will be focusing on. We're still working with Extension on identifying our key strategies or performance indicators on how we measure being able to do that, but it's just one more step here in the process. But with the delay in our goals for the county board, we need to wait for the county board to set that for us so we can bring back and discuss aligning those two.
Thank you, Tanya. I think that pretty much covers number 6 and number 7, which is the grant contract update. Yep. And our discussion on priorities and strategic planning. How about number 7, as long as you're on that?
I'm on it. So I had distributed to the people who are here the annual report. For the people who are on WebEx, we will send those out to you. It just gives a snapshot, a pretty large snapshot. I think it's about 40 pages of everything that we accomplished over the last year. But for this item on the agenda, we want to call our preliminary financial statement for 2019, which I believe we ended up overall giving back or having reallocated $68,000 to the general fund. So quite a difference from last year, and I think that's due to all of the work of the managers and staff on really looking at how we're spending our dollars and making sure that we're as efficient as we can be in providing our services to the public. So I think they deserve a big kudos for all of that hard work.
Well, Tanya, that's got to be huge. Any division that puts any money back in our general fund, that is just really awesome. So, you folks out there, I don't know if you can see this, Polk County Community Service Division, and this would be available at the county clerk's office for anybody that would like to attain a copy of that. And it's just a fantastic testimony for what our human services people are doing. Does that include Golden Age Manor report, Tanya?
Nope, it's just Public Health, Department of Children and Families, and Behavioral Health. And you'll notice on the report it says 82,000, but in working with the auditors and wrapping up some final year-end expenditures, we had a few things straggle in. So it's really
Do you know when the Golden Age Manor end of the year report is?
I do not.
John, in terms of budget, I can tell you that, as usual, it operates and is always struggling to come in at the numbers, but with the state aid this year of about $1.2 million, they did come out slightly in the black.
In the black.
But that's with the $1.2 million grant.
Yeah.
Obviously going forward, and we'll hear more about this at the board meeting about some of the challenges our overall budget is having with the virus, what that's doing is different.
And the amazing thing about Golden Age Manor is Amy and some of you new people, our administrator at Golden Age Manor, she tends to come to our board meeting and give us a report at least every quarter. And the thing about Golden Age Manor, they continue. It's a 50-year-old facility that we have in Amory, and they continually put money in for updates on our facility there. Do we have a new boiler installed? That's what we've been working on for
a new boiler.
Yes,
I believe that's it.
I believe it is. That's a huge.
Yeah. So all those things come on top of what is normally budgeted. So that kind of comes out of the general fund and repair those.
Yeah. We also have with us our administrator, Vince Netherland, and our court counsel, Miss Malone. So if you have any questions so far, I would entertain any questions.
To bring up Supervisor Pritchard's letter for the transportation. So I'm done with my presentation.
Mr. Pritchard, before we had adjourned today, we passed out a memorandum that you have here on transportation, and we'll let you speak to that.
Mr. Chair, can I ask one question? Can we just back up on that 68,000?
Yep.
Can you just give me an example on? I love hearing cut fees, and can you just give me a couple? What are we doing? If that's as fast as rock in the budget, are we cutting something that's extraneous?
We did not cut any services at all. We did a lot of enhancements, efficiencies in our business and operations unit. But also it speaks to most of our expenditures come from having to place either kids or adults who need a higher restriction of placement to be able to be safe. So a lot of that work came from the social workers and the supervisors in those units monitoring the placements, understanding that there are times when people need that level of care, but there's also a level of discharge planning that we're incorporating when they go into the care. So we're moving them in and out a lot faster than maybe in the past, or providing more preventative services so they may not even need that level of care.
And if I could add, I think part of this too is attributed to the recent divisional reorganization, because now we have Tanya, who's done a terrific job of monitoring, investigating things that we've always done in the past because we've always done them, and are now looking at what's a better way to do it. Are we eliminating the duplication of efforts? Are we using our people strategically as opposed to unstrategically, just keeping people where they are because they've always been there? And I just hats off to Tanya for finding all those efficiencies in the system. And I think she's done a great job, and I think she'll continue to find more efficient going forward.
Makes sense.
Joe?
Yes, Tanya, do you know how many people do we have that are out of state?
I believe we only have one who is placed out of state, a child.
Because I remember last year, I think we had two.
There could be some relative placements that are out of state, like a subsidized guardianship or a kinship situation. But the one that we actually placed out of state, I believe that child turns 18 this year in October.
That's quite expensive.
Mm-hmm. Yep.
Thank you.
Yeah, our biggest expense, that's really an unbelievable amount of dollars, is any in-state or out-of-state placement in our institute. Amy, and for you new people out there, the most amazing thing that I've been experiencing my time on the board here is the job that our social workers do. We've had some social workers they're always busy, but they've made a point to come to our meetings every once in a while. And they've even broke down in tears telling their stories about some of the things that they do. And they don't work an 8-hour day. They work after hours with parents and students. And I think Bill Oliva, you've been in on a lot of the work that they've done, and you've also had some amazing comments, correct?
That's correct, John. I think the social workers go above and beyond anything that they do on an 8-hour day. A lot of stuff is done in the evening, off the clock, a lot of volunteer stuff, so my hat's off to them.
And Bill, you're also on the drug court. Do you want to tell us some of the things that you do in helping the organization and the kids? Bill he's a former superintendent at Unity High School, and he's got a heart for these kids, and he does whatever he can. He's got some amazing stories. Tell us a little bit about all your enterprises, Bill.
Well, I wouldn't call them enterprises. Tanya's smiling. I think that working with youth over the past 40 years, I didn't get to rise above and be a superintendent only on an interim basis. I was one of those high school principals, and so I think that the volunteer effort of staff and parents have helped out an awful lot. It's interesting to listen to parent comments now about homeschooling, and I think sometimes they want to throw in the towel, because they now realize that it's not as easy as it looks. But we've had some amazing programs going. I think the school districts that are doing their second opportunity programs to allow students to earn a diploma above and beyond the school day is very nice with the jail programming that they have, and now in collaboration with the UW system and WITC. And so there are some great volunteers out there that we're trying to get involved, especially with the inmates over at the jail. That has been a very extensive program, and I hope to see that continue.
Thanks, Bill. I know you're also involved with the drug court. Are you on
Well, I'm not on the drug court team. I'm a member of the CJCC as the educational rep, and so I'm in on some of the planning things that are there. And again, I think my heart lies at the educational programming there, and whether individuals are in the drug court or they're part of the inmate population, I think it's extremely important that they do get their high school diploma or their HSED. And I think that education is going to improve their lifestyle immensely.
Thanks, Bill. I can't always pronounce that,
CJCC?
Yeah, it stands for Criminal Justice, what? Yes, that's
Criminal Justice Collaboration Council.
and I've attended some of their graduation ceremonies from the drug court, and it just is amazing. And the qualifications are daily; they're tested daily, and when they graduate from a drug court, it's pretty heartwarming. They have their families there. They have a regular crown there, and they made a huge accomplishment. And if you ever know anybody that you can encourage to be part of that drug court or the CJC, they can always use an extra encouragement. Thank you for all that work, Bill, and those comments.
Thanks, John.
You got anything else, Tanya, on your...
Yes. I must have inadvertently taken off the comments from supervisors not seated on the committee, but I do want to give Supervisor Pritchard an opportunity to talk about the transportation memo that he had sent us.
Are you in tune there, Mike? I'll give you the floor if you want to have any comments. We passed out your transportation presentation here, and what this is in a nutshell is St. Croix County, I believe, has in place with some other counties. I think they probably start in Eau Claire, and they have a transportation stops all the way to Hudson, Baldwin, Menominee, and into the cities. And it covers a various work transportation, doctor, medical, hospital, lots of things that have been very successful in counties, other counties. And thanks to your efforts, we're trying to get something like that into Polk County. So, Supervisor Pritchard, you got some comments?
Can you hear me? Am I coming through?
Yeah, we can hear you pretty good, Dr. Mike.
Okay. I think going back to December, we had talked about priorities, and when we talk about transportation, what I want to emphasize here is this is above and beyond the voluntary type of transportation for taking elder people to medical appointments or VA appointments and the like, and a lot of that is going on in the county, but it's the idea that someone who doesn't have a driver's license, who shouldn't have a driver's license, doesn't have a car, can live in Polk County and have a so-called normal lifestyle with access to the facilities that a person needs to access in the normal times, not like the pandemic. And it came to mind as somewhat of an add-on to the housing report, because I think in addition to housing is the transportation. And I mentioned this is just a brief memo, and it was on a work plan circulated, I think, with the April board packet, or I think it was the April board packet, but in any event, it talking about the sort of thing John just mentioned of having a van service, possibly, of having seen what it would take to get Uber or Lyft services into the county, that sort of thing, and it contemplates first doing sort of a demographic look, and some of that may be an add-on to the housing work that had already been done. But I think what it contemplates that staff, and I don't know if there'll be a couple of supervisors that might be interested in being on it, but putting together a study and report. I mentioned Larry Jepson because he had served on a number of these committees that were involved with transportation, so I think he's got a wealth of knowledge, and I would like to see that incorporated as part of the work plan for 2020 with some specifics, instructions of going ahead, and the memo itself is somewhat abbreviated, but it's the idea that these are people that maybe could pay for all of public transportation, or some portion of it might be somewhat subsidized in a way, but I think going back to our May 5th meeting where we had Sarah from the Wisconsin Counties Association talking about looking at the big picture on our board and in our committees and our Health and Human Services Board. This is one of the bigger pictures that I think affects the quality of life of I don't know exactly how many, but I'm sure many people in our county that would like to stay living here and maybe can't if there isn't public transportation.
Well, thanks, Supervisor Pritchard. No, I sure appreciate that, and I hope that everything can move forward. I'll ask our administrator. He was our former Economic Development Chair administrator, and I think you're working on something like on that end, aren't you, Dr. Vince?
Well, the housing study is completed. Transportation is certainly an issue that does come up on occasion, and both at my EDC or in this position, I have conversations with various organizations of people who say transportation is an opportunity for us. The challenge, given our rural nature, is, how much of a subsidy would it take to get Uber or someone here like that when we can't get a taxi cab driver? On the other hand, are there busing opportunities? We don't have the infrastructure for train, but I do agree with Mr. Pritchard that we could probably find some resources through the study what are the best opportunities and priorities for this county. So the West Central Wisconsin Regional Planning Commission, WEDC, the challenge will be what is our current situation here and what is it that is most needed. Is it transportation to the cities? Is it transportation for the elderly? Is it transportation for workers, given our diverse workforce here and how everybody is kind of spread out through the entire county?
That's a rather big trying to get together and work together. Is there any, but between all those different divisions of identity, do you think there's any grant possibilities?
Yeah, and I would say, I agree with Mr. Pritchard that now is the time to be bringing these up so that when we do work on our goals for the county, this might fit into what some of our bigger goals and big picture, big ticket, long-term items might be. And then I foresee us breaking it down to the committee level to decide, okay, if our bigger vision and goals are such, whether it be economic development, whether it be providing care for the elderly, this might be something that a committee, I don't know if it's this one or not, maybe it's Public Works or Public Safety and Public Works, maybe it's this one, that we may set as a priority in your committee. Let's investigate opportunities for this.
I know I've talked to Senator Schachter, and if we could get our legislators together and get any support from our legislative representatives and senators, if we could get them, I know they're personally sensitive to workforce and things like that. So, and just for the general public, always try and bend an ear to our legislators, as it's something that really is important to our residents. Amy, do you have a comment?
Yeah, I do. Vince's comment about the housing piece makes me think how interwoven those two concepts are, a house and a way to get around. And so I'd love to see all that stuff that you just laid out at kind of the beginning of the work plan and the scope of work of what we should look at. And I think, because then if we have transportation, then people have different housing opportunities. Or if we have more concentrated housing that has a component of transportation, people are able to live there. And all that stuff, I think, let's look at and flesh out and think big picture on. And of course, we're not going to figure, Rome wasn't built in a day. But
right. You're exactly right. Especially when you think of the demand that we saw in the housing study for senior type housing.
Right.
We know what the demand is for starter apartments, for example. I mean, not like my daughter who lives in Chicago doesn't need a car. I mean, people are going to need cars here. So younger people will probably have those. But the elderly, how do they get to the grocery store, the medical doctor, and so on?
In the Uber Lyft world, I mean, maybe there's local people with some sort of incentive, because Uber and Lyft are sort of region, place-based. So I don't know, maybe we set up a way that it all becomes an employment program. Here, it's Polk County Lyft. Take your car and drive people around. I'm sure there's demand for it. Maybe we market it so it does.
Jim, you're our representative on the Polk County Housing Act. I know our veterans, they're very well taken care of as far as transportation. Our veteran service officer takes care of them. How about the other people in our, we got 5 county housing units. Do they have trouble getting transportation to doctors, or how does their service work?
Transportation has never been discussed.
And
so I don't know if it's a problem or not.
I was on your board for 10 years as just a volunteer, and those units, they seem to take care of each other.
I will say, Mr. Jepson, he was here to speak about the public transportation efforts in St. Croix County. There, it was primarily a rail system that they're looking at, or a bus system to take people to and from work in the Twin Cities. And his suggestion to me was, is there a way we can get access to public transportation to get people down to St. Croix County so that they could easily access their public transportation too. I don't know if that makes sense or not, given that depending on where you are in this county, you're taking 65 down there. It may take a while, and and then coming home that way. So
I know in St. Croix County they have a service that starts at the airport, that starts at Eau Claire and goes to the airport, but they don't take anybody, just airport transportation.
Right.
But they have several runs that they, starting in Eau Claire, go to the airport and back vice versa. Do you have any comments?
I would just suggest that we don't get too far into the actual substantive discussion, since the issue of transportation was not noticed on this agenda. I think this was Mr. Pritchard's opportunity to raise the issue, and I believe Tanya has this slated for your next meeting for more in-depth discussion, so I would just make that recommendation.
Thank you very much. Tanya, then you can kind of wind up with everything.
The next item is the discussion and possible action regarding a resolution to support public health during the COVID pandemic. And this is something that Supervisor Middleton brought forward to our attention. We wanted to put it out to the board today for some discussion. Do you want us to pull up the actual resolution that you had sent us to have some talking points, or how do you want to leave that?
We could put up the concept. Excuse me. The concept of this came out, and of course I'm brand new, so I'm just shooting from the hip here. And I wanted to have input from Tanya, and so we put a pause on it. But this came to me after the initial comment from the sheriff on the fact that that the governor's order was overreach and we should be opening the county, and then my phone exploded. So in response to what I heard from my constituents, I put this thing together. It can be completely wordsmithed, but the concept that I was trying to get at was that we should be having public health as the lead on any of this stuff related to COVID. Whether we open it and when we open it, how we roll this out really should be led by public health. I don't know if that's maybe behind the scenes what's going on, but from the outside and from my constituents, it probably did look like that. So that was that was the root of it. Then I just sat on it for a week, and then there was sort of the rollback with public health, and I thought, okay, this is better. And then we had the Friday night thing, and I couldn't quite tell the first meeting whether that was better or not. I do know that the board's resolution didn't necessarily reflect what was heard in our public comments. There was really an overwhelming majority of people concerned about that messaging, and I think there's a lot of messaging problems with some places saying they can open and some places saying they're going to open. I get all that. And then we have the state piece that's sort of folded in there, and people are trying to figure it out. So I just kind of wanted to have this discussion on where maybe staff feels like you guys need or don't need. Maybe this makes a mess of things and you can fill it. But that was what I was hearing from people, and that was I got my where I was going. Not to here.
Okay.
So, and I'm not familiar with that myself. Is this a committee that you're bringing this to? Is this in a resolution form that you could hand out to us to review?
Tanya and I decided that we should talk about it today a little bit and get some feedback from other members of the committee. And Tanya, if you want to elaborate on anything, but it felt like to me, granted, I've been on this committee, an hour and a half now. So.
Are we going to have this in maybe a handout form?
Absolutely. We can email it. The final whereas piece, it might be in there. Yeah, the therefore, that Polk County Board of Supervisors in consultation with public health and medical try to pick up medical. That any changes in policies to protect the health and economy of people with COVID-19. Any relaxing of the stay-at-home order should be in consultation with public health. Mental health. So, I'd love to hear what people have to say, whether we should do anything or not.
Well, that's pretty forthright, and when you get that in a form that we can study it, I'd appreciate that.
I have a comment. Are people able to hear me?
Yeah, we can hear you, Rita. Go ahead.
Comment on that. I've been thinking along the same lines with that, and as the state opens up and businesses, salons, etc., likely we will have more cases. And I think one of the things that public health departments are doing nationally are doing contact tracing. And I don't know if there's been any discussion about taking a person from the public health department and trying to follow up on contacts of new cases and document those things, because that's going to be a big part of containing the spread, I think.
Brian, are you still on the line? Do you want to give an update on what the Public Health Department has been doing?
Sure. Can you hear me okay, Tanya?
Yep, we can hear you.
I can hear you.
Yeah, so contact tracing is something our health department has done from the get-go, from the onset. Depending on the PUI or the person under investigation, depending on their risk factors, whether they're considered low, medium, or high, that determines the extent of the contact tracing that we do. But we have 5 public health nurses who are very experienced with contact tracing. They're doing it all the time. I think we're upwards of 700 or so people that we have monitored and have done varying amounts of contact tracing on all of them. We also have memorandums of understanding with our neighboring jurisdictions that if we needed surge capacity for extra contact tracing, we would have the ability to do that. We can also tap into the state team if we needed extra capacity as well. On top of that, we have taken some other community services division staff and trained them up on the basics of contact tracing, so that in the event we really had a surge of individuals we needed to trace, we could get them involved as well. So we have we do it every day. We have surge capacity in place in the event that it's needed. So I feel pretty comfortable in that area.
Could I just ask a quick question on that? How are we contacting the contacts? I mean, do we have a procedure in place to let them know they may have been exposed to COVID-19 patients?
Yep, that's a requirement off of either a moderate, a high risk, or a confirmed case. Is we need to trace back all of the contacts to the level of a moderate risk. So that's all occurring via phone calls, emails, and it's documented within our statewide disease surveillance system.
Great, super.
Well, thanks, Brian, and really we appreciate that. It seems to be working very well. I know on the media, you'll see media people asking people if they would like to be a contact person to contact their public health departments. I'm glad that we have that covered very well. Anybody else out there, Dr. Vargas or Rita or
Dr. Vargas.
Any comments?
Ari Vargas. I fully agree with the concerns that we listen to our public health department, our scientists, and go cautiously with opening our businesses, which I think is important. And I understand the difficulties that businesses are having. And because if we open too rapidly, we will have a big surge and exceed the capacity of our health system to respond. So, yeah, let's support our public health system and the workers in our hospitals in our communities.
Thank you, Dr. Vargas. Jim, you got some comments?
Yes, Mr. Chairman. Brian, you mentioned 700 people. Is that the amount that have been tested? Or how many, where do I want to go with this? How many people in Polk County have been tested and how many have been positive?
So the numbers on that is a great question. That 700 represents those that have physically had a test that are considered Polk County residents. I'm just pulling up the numbers here that were just pulled this morning. So we are looking at, as of 10 o'clock this morning, we've had 5 confirmed. 26 individuals are considered suspect or probable and are ongoing. Those are what we refer to as our PUIs, the current ones. We have 16 that are considered suspect probable new cases. That means we've been made aware of them within the last 24 hours. we're monitoring 14 people that have a travel exposure risk. That means that they haven't been tested, but they've traveled to an area that is considered high risk. And we have 654 negative results, or clients no longer on quarantine.
Thank you, Brian. That is a terrific update. I think that everybody's been kind of searching for. And Rita, I'd like to give you a thank you. Dr. Tanya one day, and she said you came and volunteered and helped with some testing, and we need people like that. We appreciate it.
I'm happy to do whatever is needed during this time.
That covers everything that I have on the agenda. Is there anything that we'd like to have for the next meeting on our agenda? Go.
Hearing all this stuff and that, it's fine and dandy. I respect everybody's space, but then you also have to look at, we are not in the high-risk areas like Addison, Green Bay, and Milwaukee and stuff. Well, what we've got to watch out for now is that the tourism season has started.
Yeah.
All these people coming from Minnesota, so we got to watch that. But I am a firm believer of opening some of this stuff. I mean, to me, some of these companies that are running right now, to me, I don't consider them running because, they make stuff evidently. I mean, you could be like a store or a business and go sell pumpkin seeds. You could be open. So the thing is that you have to start somewhere. And what I've been hearing from other people that I feel kind of the same is that we have to do something. We have to move on. And we went through the swine flu and all this stuff. It's a pandemic, they say, but we have to realize that look at all that's happening, all these hogs being slaughtered and stuff, And I believe a lot of it is because of these places. They knew they had it, but they wanted to go as long as they could. And now they're all shut down, and now they're hurting the whole dang United States, So, and people run out, and I was at Osceola there at Dick's there, talking to Jody there in the meat department. He said he ordered 20 to 25 boxes of chicken. You need to get a one. So, and then he told me that the guy the week before come in and bought 150 pounds of chicken legs and thighs. It's a scare, yes. People, to me, I shouldn't say it, but I'm gonna, are taking it too serious. I can see, like in Milwaukee, that because they're a big population. But from the people I've been talking to, they say that, like barbershops and this and that, they're little stores, and I hate to see them go under. So, I was thinking of getting 3-4 people or whatever and going to these places and show them what they have to do to open. And, they can, from what I heard, they can write it off on team after it's all done. But they don't know. Everything changes from day to day. So that's my comment. Thank you.
I think that's what we'll find out is everything does change from day to day. And Polk County is, we have a huge tourist attraction here. So we are going to be meeting a lot of people from the outside. So all we can do is urge people to be careful.
That's right.
Comment, Amy, do you have a comment?
I guess it's more of a question. I don't know if you authored this, but I was going through and read the new COVID what are you calling it? The COVID workplace opening manual?
We have a business recovery task force that was created. That included county folks. It included our director of public health. It included chambers throughout the county, and EDCs throughout the county. The purpose was whenever business is open, and the challenge is when you get rules that are somewhat vague or foggy, you're going to have different people opening in different fashions. We didn't want to jump into that with our business recovery task force. We simply said, when you open, you are able to open. That we encourage people to follow all the executive orders. But when you are open, here are some best practices. And so it was a simple, even though this looks like 15 pages, that's a lot. It actually is broken down into a couple of brief sections that highlight if you're an owner and you have employees, how should your employees practice good, safe habits? How can you keep your customers safe? How can you keep your vendors safe when they come to school? And so we wanted business people to know we're not just here to say no and stay closed. We're here to say when you up, we'll help because it is critical. There is an economic health component to our physical health, and we wanted to be able to say we are helping people from all sides, keeping them safe, avoiding the virus, and when they have a business, or they have a job that they want to keep, they got to feed their family. What are some things that can help that happen?
So thank you, Mary. Did you have another question?
How is that getting distributed? Is it just in draft or whatever, like in the queue, and then at some point you're going to do a bunch of planning or outreach?
We distributed it Friday via the chambers, through the EDC, to contact list, that type of thing. It's also available, I think, through a link on our website, the county website or the public health website.
Good.
Yeah.
Mr.
And it's
Chair,
very similar to the state.
one of the things I wanted to update, and I don't know if everyone that's participating is aware, there was a new order from the Secretary's designee yesterday from the state that allows retail establishments that are not inside of a mall. So anything in a strip mall or a freestanding store, they're allowed to open.
Yep.
And they're allowed to open with a limit of 5 customers inside of the retail establishment at any given time. They did not base it on square footage or anything else. So a tiny little retail store is being treated as the same as a large retail store like Kohl's over in Rice Lake. So we're also waiting on the Wisconsin Supreme Court to rule on the oral arguments and briefs that they heard last Tuesday. Everyone anticipated that we would already have a decision from the Supreme Court, and so we're all kind of waiting on pins and needles. But depending upon how they rule, it might tear the Band-Aid off of some of these stay-at-home orders, and that's why having these toolkits and best practices and having our public health work with our sheriff's department and work with our business recovery task force is key, because we really don't know how much longer those safer-at-home orders are going to be enforceable, just generally based upon what the Supreme Court may or may not do.
So thank you, Vince and Malia. I don't think if anybody has any questions at all, we have a terrific business guy, Malia and Vince and our health department, Tanya. They're open for questions. Their doors are open. Their line is open. So I think we have everything covered on our agenda. If there isn't any more questions, I'll move that to adjourn. Pardon? I called for them. We don't have any. We'll be bringing that forth. Motion to adjourn? Jim?
I'll make it. Motion to adjourn.
Motion by Supervisor Jim, and seconded by Joe. All in favor, say aye. Aye.
Aye.
Thank you. Thank you out there. Thanks for participating, all you people on the outside there. I think it worked rather well. We could hear you, we could see you, and so we're looking forward to the second Tuesday in June.
Okay.
Stay healthy.
You too. You too.
Thank you.
Thank you.